Human Services to order. Please stand for the pledge to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. First up is John O'Neill. Mr. O'Neill. Good morning, John. I have no report. Any questions for Mr. O'Neill? If not, you're excused. Thank you. Next up is mental health. Morning, Steve.
Morning, everybody. I have a few resolutions to request here today. One is just handed out this morning is for a resolution appointing the appointment of George King of Westport as a member of the Essex County Community Services Board and as a member of the CSB Mental Health Subcommittee for terms effective January 1, 2015 to December 31, 2018.
Could somebody move that, please? Mr. Grinnell or Mr. Merrihew? In your seconding? Discussion on the appointment? If not, all in favor? Opposed, carried. Thank you.
Okay, and a resolution authorizing the appointment of Clifford Johnson of Port Henry as a member of the Essex County Community Services Board and as a member of the Community Services Board Mental Health Subcommittee for terms effective January 1, 2014 to December 31, 2017.
Somebody move it, please. Mr. Grinnell, second. Mr. Gillum. Discussion? All in favor? Aye. Opposed? Carried.
Okay, and then on a separate sheet, I have a couple more resolutions. The first is a resolution authorizing the appointment of the following as a Director of Community Services designee physician in accordance with New York State mental hygiene law, and that is for Senator Hazelwood, MD, which will allow this physician to provide safe evaluation and care of acute psychiatric patients at Adirondack Health.
Would somebody move that, please? Mr. Merrihew. Seconded by Mr. Grinnell. Where's this individual from, Steve?
I don't know where he is originally from. I didn't bring I do have his resume, but...
Okay, yeah. Sorry I put you on the spot.
Yeah.
I was just curious.
Yeah.
Discussion? All in favor? Aye. Opposed? Carried. Anything else, Steve?
I have one more, and that is a resolution authorizing a budget amendment request to increase 2015 revenue and appropriations in the amount of $42,500 to allow Essex County Mental Health to receive electronic health record incentive payments and to submit an RFP to purchase a new electronic health record and practice management software.
Somebody move that, please. Mr. Preston, do we have a second? Mr. Grinnell, discussion. Being none, all in favor? Opposed? Carried.
Okay, I have nothing else.
Any questions for mental health? If not, thank you, Steve.
Thanks.
I'm going to go out of order here and ask Patty to come up.
Good morning. Just two informational things. I just want to remind the folks that sit on the nutrition program subcommittee that a meeting was scheduled or is scheduled for next Monday, I believe. That's one thing I want to remind. Judy sent out an email on that. It's really going to be an important meeting because we have like 3 issues right now going on. Second of all, May is Older Americans Month, and I'm just asking for a resolution for recognizing, poor guy, recognizing May as Older Americans Month in our county as well.
Thank you. Oh,
Please.
you want me to move that? I'll move it.
There you go.
Do we have a second? Mr. Harrington, discussion.
Can you define older Americans? Dan Connell comes to mind.
I just turned 70.
It's all relative.
All in favor? Aye. Opposed? Carried. Anything else, Patty? Any questions for Ms. Badgerow? If not, thank you. Thank you. Transportation, Nancy Dooley. Good morning, Nancy.
Good morning. I have 2 resolutions. One is to dispose of 2 vehicles. I've sent the request to the state, and if I get this going, then by the time I get this stuff from the state, I can get them on the auction calendar sooner. Neither one is running right now. One is a 2006 and one is a 2008. The value of, or the amount to fix them is more than the match to buy a new bus.
Would somebody like to move that we surplus or dispose of the two vehicles? Mr. Preston, do we have a second? Mr. Grinnell. Discussion? All in favor? Aye. Opposed? Carried.
The other one is to accept our annual report and place it on file for 2014.
Somebody move that, please. Mr. Grinnell, do we have a second? Mr. Merrihue? Any discussion?
I did not yet.
We will get copies.
I just finished it.
We'll get copies for you before the next committee meeting.
All in favor? Opposed? Carried. Anything else, Nancy?
We have a meeting, a subcommittee meeting at 11 o'clock.
Who's on that subcommittee?
You, Randy, Mike, Roby, but he's on vacation.
Thank you. And finally, public health. Good morning.
Good morning. I have no resolutions, but I do, actually, that's not true, I apologize. I have a resolution to accept our annual report, but you will see a presentation shortly by Andrea Whitmarsh, who is our new public health educator, and it's the first time we met her. I did want to tell you a little about her. Andrea graduated from SUNY Plattsburgh with a cellular biochem degree, and she went on to get her master's in public health, and she joined us in January, where she was, before that she was working for the North Country Healthy Heart Network, and prior to that she was working in a pharmaceutical manufacturing plant, so she's a really well-versed, and we're thrilled to have her be our new health educator, and she will review our annual report. After that, Jessica's going to talk. Randy Douglas heard of our silent strike. It is a pod, a point of distribution event that's coming up, and I'll let Jessica talk about that more. I would like to call your attention to the New York State Park and Trails Day, which is going to officially be May 2nd, but in Essex County we're going to celebrate it on May 1st, which is Friday, at Footbridge Park. You're all welcome to come. I'm working with Noel, and we're going to invite county employees or whatever, and we'll have some rakes and shovels for anybody who would like to walk around and clean up the park that day during their lunch hour. So I would like to ask that I have Andrea come forward and present the annual report.
You may. You want to a resolution accepting and placing on file first or after it's discussed?
Well, maybe you want to hear it first, then we'll make a resolution. Sound fair?
Okay, we'll hear it first.
Thank you.
Come on up, Andrea.
Dave, she's a presentation.
Oh, she won.
The presentation, yeah.
Okay.
All right. There's a little... Okay, there's a little... Push it. Yeah.
Out of money.
Perfect.
Lost the county credit card.
So thank you, Linda, for the introduction. As she said, I'm Andrea Whitmarsh, and I'm here because we wanted to recognize National Public Health Week by talking a little bit about what we do at Public Health, and also to highlight some of the things that have happened over the past year in our programs. So currently at Essex County Public Health, we have 4 major program units, which is Preventive Services, WIC, the Children's Services, and the Home Health Aid Agency. So operating under New York State Public Health law, we must assure that certain performance standards and minimum requirements are met in community health assessment, emergency preparedness and response, chronic disease, communicable disease control, and family health and environmental health. So if you want to do the next slide. So we're going to start with the community health assessment, which was completed in 2013 and identified the prevention agenda priority of preventing chronic disease as a top priority for Essex County, which some of you may know. And we want to do that by reducing the rates of obesity in this county among children and adults, and also by improving access to care, to chronic disease care and management. And also we have done the Community Health Improvement Plan, which goes through 2017, that outlines our objectives and goals for meeting this priority. In 2014, we received a Health Foundation grant, which is going to allow us to further our work towards meeting this prevention agenda goal, and we've identified 2 area schools, Mariah and Crown Point, and 2 local businesses, Elizabethtown Community Hospital and the County Nutrition Program, as targets for advancing nutrition standards within these businesses and schools, and having them adopt nutrition policies that support better nutrition standards. Next slide. So going along with this as well, we have a chronic disease prevention program, which allows us to reach the entire county by our cancer screening program, which is some of the pictures that you see, and also the Creating Healthy Places to Live, Work, and Play, which many of you have probably heard of, because Meg has been able to reach pretty much every community within our county with a lot of the initiatives that she's been working on. As you see, there's a couple examples here. But these programs increase the access to nutritious foods, to cancer screening, chronic disease care, and they allow for an increase in opportunities to be physically active, which are both critically important in a rural county such as Essex County, as you know. Next slide. The next one, Jess is going to talk a little bit about this today, but I wanted to touch on our Emergency Preparedness and Response Program, which the picture on the left is an example of a pod, which is what Jess is going to talk about, but it's going to be the medical countermeasure pod exercise coming up. And the other picture is a nice example of one of our staff members in some PPE, which is, I'm losing it now, personal protective equipment, that's right. So in 2014, because of the Ebola outbreak, Essex County had to ramp up measures to make sure that we're ready if anything were to happen. This happened globally, nationally, at the state and local levels. Everyone has to prepare and make sure that we have the staff training and capabilities in place to address any kind of outbreak should it occur. Also in preventive services, we have communicable disease prevention, which includes our STD, HIV, HCV education, screening, and prevention activities. We have a immunization program, which is a very robust program of clinics, education, and outreach to ensure that we're targeting the appropriate populations. We have a rabies control program. As many of you may know, we offer various clinics throughout the spring, summer, and fall months. And we've also had last year in 2014, over 1,100 animals were vaccinated as part of this program. And we had over 17 clinics, as well as doing rabies investigations for possible rabies exposures within the community. And then finally, 2014 saw an opportunity for public health to do some outreach for Lyme prevention because it's becoming more endemic in our county as opposed to an emerging infectious disease. So we had a comprehensive Lyme outreach program put in place where we went to trailheads, golf courses, libraries, the county fair to provide outreach and education materials for people that would be outside to know that Lyme disease is in our communities and it's something to be aware of. Also in preventive services, there's a family health program which covers maternal and child health. There's a Medicaid obstetrical maternal services and infant and child home care. Within this program, over 50 newborns were screened. An additional 200 maternity packets were sent out. It's a very busy program for our nurses in the department because they're doing visits with children and infants and teaching new moms, the importance of caring for their newborns and, what to look out for. And this is a picture of one of our public health nurses with one of the new moms in the community. And finally, in preventive services, we have environmental health, which includes car seats, lead screening, and also we're part of Safe Kids Adirondack, which goes out and provides bike helmets to children in the community. Last year for Safe Kids Adirondack was Clinton County, and this year we're going to be going to 4 different schools in Essex County to be providing bike helmets to children at those schools. Also part of public health is the WIC program, Women's, Infant, and Children. They provide vouchers for nutritious foods, support for nursing mothers, health referrals, and nutrition education and assessment. And the Children's Services Program, which includes early intervention. So for families that have children age 0 all the way up to 21 that have a diagnosed disability, they're able to have referrals for services, and there's over 120 active cases currently in that program. There's the children with special health care needs. I'm sorry, I said that. The early intervention is 0 to 3. I apologize. Children with special health care needs is 0 to 21, and there's over 60 active cases in that program. And in the preschool program is for children aged 3 to 5, and it's a transition program. A lot of the children that are in that were in the early intervention to begin with, and it's to get them ready for kindergarten and to go on to school. And finally, the Certified Home Health Agency is a program that is approaching 50 years of service within this county. It allows residents to remain in their homes and receive skilled nursing services such as PT or OT. And this program has consistently met or exceeded New York State and national standards for quality measures. So I just wanted to point that out as something we're very proud of as well. And we just have a video if it works.
Thanks, Andrea. Excellent presentation. Any questions on the services that public health provides? Yes, Mr. Grinnell.
Just a comment. As someone that has had the opportunity to work with our public health agencies, the home nursing program in this county is second to none. And everybody should be aware of that. They do a fantastic job.
Thank you. I totally agree with that comment. Thank you. We need to move the 2014 annual report. Would somebody like to move that, please? Mr. Grinnell, do we have a second? Mr. Merridew? Any discussion? All in favor? Aye. Opposed? Carried. Thank you.
Jessica just has one more thing, Dave, about the silent strike, the next thing in front of you that Randy has to come talk about. I'll be fast.
You need the overhead?
I do not. No, thank you. I don't know if the microphone's on or not, but every year in New York State, all the local health departments are asked to conduct exercises that are full-scale. Sometimes we do drills. We do several drills throughout the year. We also have to do one major full-scale exercise. In many of the years past, I've been here since 2008, we've been doing flu clinics, mass flu clinics, which allow us to serve hundreds of people at one time at a single point of distribution. This year, the state is asking that all of the local health departments conduct a mass countermeasure to the threat of aerosolized anthrax. And so the premise is that this agent has been released widespread throughout New York State. All the local health departments are asked to respond by providing medical countermeasures to the population. The reason why it's done like this is obviously if a tremendous amount of people were impacted at one time, it would overburden on our healthcare system for everybody to go in and see their provider or enter the emergency rooms. So this is a prophylaxis that we can administer through a federal emergency use authorization. So what we're doing on May 5th is we'll be at Mariah Central School. We are going to be issuing mock medical countermeasures, and it's a 3-day supply that people would go through. They basically can register in advance electronically on a website of the state, or they can appear at that time and just enter it. It really takes about 2 minutes to enter in your personal information, your demographics, your name and your address, and then there are only 7 questions that you need to answer. And then people would be dispensed one of 2 antibiotics. If it was contraindicated for one of those, we would refer to a healthcare provider. So the exercise is from 1 to 3, Mariah Central School, May 5th. We're inviting anybody that is interested in seeing how we operationalize this sort of thing. Please come and attend. If you'd like to go through as a community member, that's fantastic. If you'd like to go through as a number of community members with different aliases, you're welcome to do that also. We have to get through 322 people in 2 hours. You can also pick up head of household medication, so if you have other folks in your family, you can register them, pick up for them, and that helps us with our throughput. So this is a 1-pager on the exercise, and then on the back is a schedule. We'll be there all day. We hope to see some of you. And I'll leave over on the desk where the agendas are a volunteers needed flyer. Feel free to take some and disperse them to other folks that you know. Just gives a little bit about the exercise and what's involved and invites people to participate. Anyone have any questions?
Any questions for Jessica?
Thank you.
Is there anything else to come before Human Services?